there. Welcome. My name is Cassandra Canyon. I'm a licensed clinical psychologist. I am also an EMDRIA approved consultant, and I also am an APA approved sponsor to provide continuing education. So, I wanted to talk a little bit about some of the addiction focused protocols that are available to EMDR treatment providers, especially because I see a lot of people posing on EMDR listservs. What do you think about this protocol? What do you think about that protocol? And it always depends. In a previous video, I talked about the importance of understanding certain aspects of your client's presentation when it comes to where they are in addiction recovery. And very briefly, understanding their level of motivation for recovery, as well as internal triggers, external triggers. When did their addictive behavior or substance use get worse? What was going on around that time? So that those basics can help you start to conceptualize better how to really address substance use with your client. Also, as you have been assessing, evaluating, understanding their internal and external triggers, again, which help you choose your protocol, you hopefully are also developing a relapse prevention plan with them, which is, what are the external triggers that I have to be most careful around? And if I am triggered, what do I do? What's my plan? Internal triggers, what's my plan for these? How do I prepare for a wedding where everyone's going to be drinking or Super Bowl or, you know, holiday parties? How do I prepare and plan for those? And so those relapse prevention plans should already be in place before you begin these addiction protocols. And remembering that if your client does have a slip or a relapse, and also depending for some clients, a slip or a relapse is not, they're still kind of exploring where they are and if substance use is a problem. Other people are further along, and a slip or relapse could mean their spouse is saying, that's it, it's a divorce. So everyone's very different in where they are. Um, but you want to make sure that if there is a slip or a relapse, how do we adjust our relapse prevention plan? I have a digital download for relapse prevention for substance use and problematic behaviors for like the initial when you're newer, someone's newer in recovery and they're still figuring out uh what really impacts them and what they're able to handle. And then I have a separate one for the person who is further along in recovery and they've got things dialed in, but it's more of a this is what's pretty solid and what works for me. And then what are some upcoming events I need to prepare for? I think people really overlook that. Preparing for my daughter's wedding, right? Whatever that is, everyone's doing a champagne toast. Um, some people feel like if they're harm reduction, if they're the harm reduction route, they may say, that's not a problem. I can have a drink that night and I'll be fine. Other people are abstinent and they know that if they have one drink, they will end up just down that slippery slope and losing everything. So you need to understand that about your client too. Where are they at and what are their motivations at? So once you understand all of that, once you have a relapse prevention plan in place, once your client is ready to begin addiction focused EMDR, there's several protocols. And obviously there's the standard protocol that you would use if flashbacks of a particular traumatic event is what is driving them to drink or use. Then you process that. But it's usually a lot more complicated. So I want to be sure to reference the correct people when it comes to these different protocols. But a major protocol that you're going to hear a lot, it's called CravEx, CRAV, and then a capital EX. And that's typically by Hase. And this protocol actually has the most evidence base behind it. And you can attend my CE course, Applying EMDR to Substance Use Treatment, that actually goes through the evidence base for each addiction-focused protocol. CravEx actually has the most research that validates that, and CravEx actually uses the standard protocol, and typically with CravEx, you are processing the different clusters, relapse, different craving episodes. So usually it's like the earliest craving you can remember, the worst craving you can remember, the most recent craving you can remember. Same thing for relapse. So that's more CravEx is relapse episodes or craving episodes typically. Another protocol is the feeling state addiction protocol. And that one's actually very long and complicated, and I recommend that you actually do um a formal training on that, which I don't offer. But the feeling state addiction protocol actually gets after what are the needs that substance use or problematic behavior are trying to meet. And so you're evaluating connection, belonging, a feeling of being alive. You get that one a lot with gambling. Gambling and shopping are often the seeking that feeling of being alive. Like that. Celebration is a big one. So understanding if your client really is trying to get some internal needs met, then feeling state addiction protocol is more likely the direction you're going to go. If someone's really impacted by external triggers, then you're more likely then to go the DeTUR route. That's DETUR. That's by Dr. A.J. Popke. He passed away, but there is a on-demand course for that protocol that you can attend. That one also, like the feeling state protocol and the DeTUR protocol, both are longer protocols that you're going to want to do like a full training on. And I just didn't feel comfortable doing that because it feels like the founders of those protocols should be doing that, and they do have courses available for you. Another protocol that I don't know if other people are doing this, but something that I noticed is a lot of people really idealize the behavior of the substance abuse. You'll hear people glamorizing it, and so I've took the idealization protocol. And that protocol, it's actually that protocol is more for addressing problematic relationships, particularly with maybe domestic violence. Well, substance use or problematic behavior, there's a relationship there. And so what I do is I typically will address the idealization of substance use if that's a problem that the client has. If people have fears about recovery, Flashforward is really helpful. If people have ambivalence about recovery and they're really in those early stages of motivation, then you have the two-hand interweave. So all of those are possibilities. Again, you want to do a very careful and thorough evaluation with your client to really ascertain where you need to go with substance use treatment. I hope this was helpful. I have some digital downloads available if you're interested. One for helping you create a relapse prevention plan with your client for earlier in recovery. For someone who's more stable, solid in recovery, they're more in the maintenance phase, then there's a separate one for that. I also have target selection for your client to hand out you can give them, target selection for you as a clinician, questions you can ask that actually then plug in to the other protocols, and I actually have a protocol walkthrough. It's like 17 pages. I have the general protocol walkthroughs along with the references for where you can find more information, and obviously giving the credit due to those people whose protocols they are. And so I feel like that really does set you up to really have a good grasp of how to help your client. And as always, it applies to the substance use, applying EMDR to substance use treatment, 2-hour self-paced CE course. If you have those and you have that, I feel like you're in a really good spot. You may have had that experience where you do a CE course and you feel like you need to write your own fake worksheets. I have those for you. So you can find those all on my website under the therapist tools page. Again, I hope this was helpful.